Hi, good afternoon. My name is Eduardo Garcia. This presentation is called Nursing Informatics for Organizational Leadership in Informatics, Nursing 514. Thank you for your time and undivided attention. Let's begin. Introduction. So what exactly is nursing informatics? Nursing informatics consists of using three types of sciences, consisting of computer, nursing, and information. This dynamic field then brings together these three key disciplines, nursing science, computer science, and information science, enabling nurses to utilize the technology available to effectively manage themselves throughout the healthcare setting or practices. This ultimately not only improves patient care, but it also enables providers to facilitate their workflow for whom the patients that they care for. So let's take a look at the three types of sciences now. First of all, computer science does utilize nursing knowledge to improve patient care outcomes. For example, using electronic health records or the EHRs. This does help nurses access patients' data efficiently, enabling them to make informed decisions, such as looking up medication dosages to make sure that the patient is receiving the proper medication. The next bullet, nursing science. This does incorporate computer technologies to enhance clinical workflows. For instance, clinical decision support systems do assist nurses in assessing patient conditions. That way, they're able to recommend any type of appropriate interventions. An example of this would be was using this information to make nursing care plans. Lastly, information science does focus on managing organization and organizing healthcare information. An example is the use of standardized nursing terminology to communicate among healthcare providers. An example of this would be getting an order from a doctor, such as please give the patient 800 milligrams of ibuprofen stat. The abbreviation stat is we do recognize that as of it needs to be given right now. It's very important for you to give it, not later. It needs to be now. Okay. Right. So the role in healthcare, how does this have a role in healthcare? Nursing informatics does it utilizes nursing knowledge to improve patient care outcomes and treatments. It incorporates computer technologies to enhance clinical workflows and focuses on managing and organizing healthcare information. Okay, next slide. History of nursing informatics. Here we will be talking about the evolution, how it started, and where it's at this time. So during the early stages, nursing informatics emerged in the early 1960s when computers were introduced in the healthcare settings. New technology and applications in healthcare was just starting to emerge. So during this era, computers were primarily utilized in the healthcare setting for administrative tasks and to do basic data processing rather than direct patient care. Okay. Moving on to the 1970s, 1980s, this era, this is where you see early efforts pretty much focus on computerizing patient data and administrative tasks. Technological advancements during this time period allowed for more diverse applications, and it did have a shift towards computerizing patient data and the medical records. Electronic data storage allowed for more organized and accessible patient information. This, in return, did replace many of the paper-based records in some instances. Um, Moving forward to the 2000s, during this era, considerable transformation in the use of computer health systems. This era did mark by significant advancements in technology and widespread shift towards digitalization. During this time period, computers became a very integral part of various workplaces and also had a big impact on the healthcare delivery system. It led more It led to more sophisticated and comprehensive applications for the healthcare world. This advancement's made clinical decision support easier for patient care, and this did leverage it leverage of big data to come together to improve patient care and the healthcare outcomes. So this is where you see multiple softwares and computer systems come together to be able to access patient care in one platform. As of now, telemedicine and remote patient monitoring have expanded significantly, especially after the COVID-19 pandemic. So this right here, it did allow or enable remote consultations, virtual visits, and monitoring of patients in real time from a distance without having too much patient interaction. So this right here, moving forward into the future with technology and medicine, this is where some people think sky is the limit. One of the big pushes forward at this current time are microbots with patient care or with healthcare. And the microbots is exactly what it sounds like, microscopic robots. So this does hold a tremendous promise for future healthcare applications due to the potential of various medical applications. So some of these tiny devices are often so small, they're often less than 1 millimeter in length or diameter, and they have the capability to navigate into the human body, within the human body, to perform specific tasks and deliver targeted treatment. So this should be big within the next couple of years coming up. All right, next slide, impact of nursing leadership. Here we'll be focusing on three things. The first bullet, enhancing patient outcomes. So here is where we, as future nurse practitioners or advanced practice nurses, we can use these tools in order to improve patient outcomes. We also can analyze data, therefore improving our treatment plans with patients. And not only that, but patients will have an improved patient response to the therapy or treatments that we will be giving them. We can also use this to then change or implement patient care strategies. This often will be aimed to enhance patient safety and the quality of patient care. Next bullet, empowering data-driven decisions. Nurse leaders often have access to myriad amounts of data from numerous scientifically backed sources now, which is great. We can use this to enable evidence-based practice or decisions to affect patient care and improve the outcomes in order to make the treatment that patients are receiving safe and ethical as well. Last one, streamlining process uses technology integration. Nursing informatics assists, therefore assists for a smooth workflow. Leaders can often implement these types of systems in order to reduce repetition. Efficiency then allows us as future leaders to focus more on patient care as well. Furthermore, nursing leaders utilize informatics to drive initiatives aimed at improving patient outcomes. By leveraging technology to collect and analyze data on clinical interventions. By leveraging technology to collect and analyze data on clinical intervention treatments and patient responses, leaders can identify best practices, monitor quality indicators, and implement evidence-based strategies to enhance patient care, safety, and outcomes. Nursing informatics provides nursing leaders with the tools and insights necessary to make informed decisions, streamline processes, and drive initiatives that ultimately enhance patient outcomes and the overall efficiency of the healthcare delivery system. Moving on to the next slide. Impact on clinical practice. So here we'll be focusing on three things. First one's going to be optimizing communication. So here is where we use this to foster seamless communication among healthcare professionals through shared platforms. This does enable an efficient collaboration amongst one another, therefore providing timely information of sharing, being medical records, labs, any type of treatment plans, and this does allow us for better coordination of the patient care. Next would be improving patient care. This does enable clinicians to access comprehensive patient data, including medical history, medications, test results, leading to more informed decision-making and personalized care plans. So this does help providers, especially if you are taking care of patients that have multiple comorbidities, and you as a provider are able to access, like a specialist consultation like renal, cardiology, or whatnot. That way you can be up to date as to what type of care they're implementing in order to gather all that information to improve the patient care. Lastly, enhanced documentation. This does facilitate accurate and timely documentation of patient information. This does ensure standardized records and helps reduce errors in charting. This right here, the nursing informatic tools, it does significantly impact patient care by providing clinicians with comprehensive and readily accessible patient information through the electronic health records, or EHRs, and other integrated system nurses use, and other healthcare professionals can quickly retrieve it, crucial to patient data and allowing for the care. And also allows for the informed decision making much faster, not only by digitizing patient records is a good thing, but this allows nurses can therefore efficiently document patient assessments, interventions, and outcomes. Furthermore, nursing informatic tools play a pivotal role in optimizing communication among healthcare professionals. Collaborative platforms such as the messaging system and shared databases enable efficient information exchange and interdisciplinary communication. Okay, next slide. Impact on administration. So what does this do on administration? So focusing on three things. Enhanced decision-making. Informatic tools provide administrators with comprehensive analytics and reports. This enables evidence-based decision-making policy formulations easier, and allows for a proper strategic planning. Excuse me, I got tongue-tied with that word. Next bullet, efficient resource management. The informatics system then facilitates data-driven resource allocation. It ensures optimal utilization of staff, equipment, and facilities based on real-time data and on-demand information. Last bullet, streamlining administrative tasks. Nursing informatics there automates administrative processes such as scheduling, billing, inventory management, reducing manual workload, and enhancing efficiency. In healthcare administration, nursing informatics serves as a fundamental driver of operational efficiency and informed decision-making, significantly impacting various administrative functions within the healthcare setting. This facilitates efficient resource management within healthcare organizations through the analysis of real-time data on patient flow, staff workload, and equipment utilization, administrators can then make informed decisions about these the resources and allow them to allocate them accordingly. Furthermore, the informatic tools used here provide administrators with valuable insights through comprehensive analytical data and reports. These tools do enable administrators to access and analyze large amounts of data sets, generating meaningful reports and performance metrics. Furthermore, information tools such as these do allow administrators to access and analyze these data sheets. An example of this would be working in the emergency room, generating reports of patient care, patient satisfaction, and not only that, but any type of data missing from patients' charts, such as the nurses forgetting to document the medications that were administered with any type of follow-up, especially with pain and other medications such as that. Okay, next slide, impact on education. So how does this impact education? So three things. Integration into nursing education. This right here is integrated into its curriculum to educate students on technological applications in healthcare, teaching data management, and informatic principles and system usage. Next one, enhancing understanding of technology. Students do learn to navigate electronic healthcare records, or the EHRs, utilize informatic tools, and understand the role of technology in improving patient care and healthcare delivery. Preparation of future nurses. So this right here, very important. Nursing education and informatic equips students with skills to adapt to technological advancements, fostering the readiness to utilize informatics in clinical practice. So nursing education plays a crucial and a key role to prepare us for future job roles. Not only this, nursing education has evolved to incorporate nursing informatics, recognizing its significance in preparing future nurses for the technological-driven landscape of the modern healthcare field. Nursing informatics also seamlessly integrates into nursing educational curriculum now. Students introduced to the informatic principles, data management, and utilization of technological systems within the healthcare setting. This integration not only enhances students' understanding of technology in the healthcare setting, they also gain hands-on experience navigating the EHR. Therefore, they are familiar with these types of tools themselves. So whenever they hit the workforce, they're a little bit better trained. As technology does continue to advance in healthcare, nurses must adapt to new systems and innovations. Education in nursing informatics equips students with the necessary skills and knowledge to embrace technological advancements. This does ensure we are ready to incorporate this information into our clinical practice once we graduate and are able to provide patient care to our future patients. Okay, so in summary, the integration of nursing informatics and education enriches students' understanding of technological in the healthcare field. It equips them with essential skills and knowledge in order for them to navigate the informatic tools and prepare for a technological-driven healthcare environment in the future nursing careers. So I remember going to nursing school. One of the big things was getting familiar with like IV pumps, how to use them, how to set them, so on and so forth. So whenever we hit our first jobs, I remember it was pretty much the same type of pumps we used during nursing school. So I picked that up in a heartbeat. So this helped me be better prepared, not only as a nurse, but it allowed me to take care of patients in a better, timely manner. moving forward. So how has this had an impact on research? Three things. Advancing analysis capabilities. Uh, these types of systems provide sophisticated data analysis tools. This empowers researchers to analyze large data sets, identify trends, and use them to derive meaningful insight for evidence-based practices. Um, Enhancing research methodologies. This drives advancements in research methods, allowing researchers to explore new avenues to conduct studies and validate practices throughout data-driven approaches. Okay, and lastly, facilitating data collection. These type of tools enables efficient and comprehensive data collection from various sources, including electronic health records or EHRs, and clinical systems, supporting research initiatives. So nursing informatics serves as a catalyst for advancing research and methodologies in the nursing field, providing researchers with powerful tools to collect, analyze, and utilize data efficiently in order to be able to provide evidence-based practice. Um, Firstly, informatic tools significantly do facilitate data collection for research purposes. Things such as the EHRs and clinical databases, researchers gain access to a vast amount of diverse data sets, which they in return use to gather all this data and make available for us. Informatics systems does offer advanced analysis capabilities that are very valuable for nursing research, not only for nursing research, but just in medical research in general. Researchers also can utilize sophisticated tools to analyze large amounts of data, identify patterns, and extract any meaningful insights. Okay. By integrating technology-driven approaches into research practices, nursing researchers can then explore new avenues and conduct new studies more efficiently and validate practices through data-driven analysis. So in summary, the link between nursing informatics and research is very instrumental in advancing nursing research, medical research um, for now and for future generations to come. So how does governmental regulation and organizational policy play effect on this? Influencing adoption and implementation, government policies and regulation mandate standards required for health information systems adoption, influencing the implementation within the healthcare organizations. So this does ensure compliance. So this dictates data security, privacy standards, and personal compelling organizations to comply with stringent guidelines. So this right here does keep patient confidentiality at the highest. Lastly, the driven standardization. Government regulations encourage a standard of health of information systems, fostering the amount of data exchange among healthcare entities and how it's shared. Policies and regulations set forth by the government bodies does mandate a set standards and requirements of health information systems. Organizations such as these are obligated to align their systems with regulations dictating the functionalities and features necessary for compliance, such as regulations like HIPAA play a pivotal role and ensures compliance and safeguards patient data. For instance, HIPAA sets stringent guidelines for data security, patient privacy, confidentiality, and much more. Furthermore, government regulations drive standardization efforts in health information systems by stipulating standards and data exchange requirements, regulations encourage standards across the healthcare entities. For example, when sending an email, a lot of these organizations do have firewalls, filters, so you're able to send a secure email within the facility without being concerned of the data being lost by hackers or phishing scams or so on. Okay, so here, let's take a look at transforming data into knowledge. So what exactly is, what is a nursing role? So here we will utilize data for patient care. How can we do this specifically? Example of this would be utilizing data for patient care. And how do we use this? Um, Utilizing informatics to transform healthcare data into additional knowledge. And is education important when it comes to this? The answer is yes. So a couple of scenarios here. One scenario in particular, so the scenario is in a hospital setting, when nurses use the electronic health records or the EHRs and informatics tools to track patients' vital signs, medication administration, and treatment responses. For example, working in the emergency room, we start this off. So whenever we transfer patients over to med-surg or to the other departments, they do have access to everything that we provided to the patient, including medications, what we did, the times, all that stuff. Data collection. Nurses then collect real-time data on patients' vital signs, medication history, and treatment processes throughout the EHR systems. What do we do with this? We do analyze, and it helps our decision making using informatics tools. We as nurses analyze and collect data, identify trends, and recognize any deviations from normal ranges. So then the last thing you have to do is acknowledge, and you have to put into action. Recognizing a concerning trend in a patient's vital signs, we as nurses then have to intervene promptly, notifying the healthcare team and adjusting the treatment plan as necessary. So this is very important, and this sometimes we play over and over in our heads, subconsciously, especially working in the emergency room. Okay. The nursing role in utilizing information transforms healthcare data into actionable knowledge. This is pivotal in delivering optimal patient care. An example of this demonstrates how nurses leverage the informatics tools provided to benefit patient outcomes. Once the data, such as vitals, is collected, nurses can then use this and utilize the information to analyze this information and then identify any types of patterns, deviations, and trends in the patient's health parameters. And not only allows for better patient care, but it enables them to recognize potential issues or changes that may require an intermediate intervention. If a nurse, for example, does notice anything concerning or any concerning trends in the patient's vital signs, through any type of data analysis, such as unexpected increased blood pressure, informatic empowers us to promptly recognize the deviation from normal ranges. Utilizing this action and this knowledge allows us to intervene immediately. We are then able to notify the healthcare team, and we are able to adjust the treatment plan as necessary. Okay, nursing informatics also enables nurses to translate raw data collected from EHRs into meaningful insights that guide their clinical decision making. One classic example of this that will stick in my head for years to come. While working in the emergency room, we did have a patient with a traumatic brain injury. So report, EMS called, they went to the border to pick up a patient. that had a dresser fall on her. That was all the information that was given. At that time, um, I was responsible for my patient load. Patient arrived to the emergency room. They were put in a hallway bed, and then one of the other nurses took it. Um, One of the things that did, you know, screamed out was how the mom and how the little 2-year-old showed up to the emergency room. Mom was covered up in blood. Patient was also covered up in blood, and they did have a bandage all over their head or their top of the scalp. Um, Per report, patient sustained a pretty massive injury. The only thing is, you know, even though it wasn't my patient, I did have a 2-year-old at the time, so I can recall even just bumping her head or just anything, she would cry bloody murder. Except this patient here um, was quietly asleep in the bed. So this was not your typical way of acting for a 2-year-old, especially with the extensive amount of injury she received. So I took over care for this patient immediately. And one of the first things, of course, was to set eyes on the injury. So I first gathered the supplies with the help of the charge nurse. We were able to gather the supplies, and then we started to uncover her scalp. Patient ended up with a massive full girth laceration to the forehead, probably about 5 inches across. You can see her skull. We continued to uncover her scalp region, and she had a like de-scalping, like a de-glove wound, probably a good like 10 inches from her frontal all the way back to her occipital area, and it was massive. There was no bleeding, no nothing. Immediately, I had to use the information, you know, vital signs, the way the patient was acting, the amount of blood on her clothes, on the mom's clothes. And at that time, I did use all the information, and I had to uh, do some clinical judgment, and I ended up transferred her to UMC El Paso to a level 1 trauma. Um, Called the helicopter. All within 30 minutes, patient was in and out of the emergency room. All this was also done without the consent of the doctor at the time. She was refusing to send the patient to another hospital, even though our facility was only a critical access hospital. So any type of trauma, especially like level 1 trauma, we immediately had to fly out of the facility. So me and the nurse sent her. Um, we flew her out, even though the doctor did get like a little upset. Um, Come to mind that whenever the patient got there, by the time the patient got there, CT results did show a decompressed skull fracture with massive amounts of intracranial hemorrhage. So if patient would have stayed there a little longer, we would have lost her right then and there. The only thing is, unfortunately, the patient did not make it due to the substantive amounts of injury sustained and blood loss. So patient, per report, we ended up finding out that the patient did pass a couple of days after. But we did everything possible to be able to use the information at hand and make a clinical judgment based on that. So last slide, the conclusion. So in conclusion, nursing informatics is defined as the integration of nursing science, computer science, and informational science, empowering healthcare throughout technology. Evolution and impact, nursing informatics has evolved, influencing leadership, clinical practice, administration, education, research, and patient care. Leadership and clinical practice. This has empowered nurse leaders to make data-driven decisions, allowing for a much more easier workflow and enhances patient care through technology integration. Education and research integrates informatics into education, preparing for future nurses, future advanced practice nurses, and advancing research methods for evidence-based practice. Government regulation influences health information systems, ensuring compliance, uh, standardized testing, standardizations, and data security in healthcare. Transforming data. Nurses utilize informatics to transform data into actionable knowledge, benefiting patient care through a timely executed intervention. So in conclusion, nursing informatics stands as a pivotal force in shaping the future landscape in healthcare, as illustrated by all the key points highlighted throughout this presentation. The information, the evolution and the impact of nursing informatics have been evident across various domains, influencing leadership, clinical practice, administration, education, research, and patient care. It empowers leaders and us as leaders to streamline workflow, enhance patient outcomes throughout technology integration. Moreover, nursing informatics does integrate very well into education now, preparing us to navigate through a technology-driven healthcare environment. It also advances research methods by fostering evidence-based practice and continuous improvement in patient care. Overall summary, nursing informatics is at the forefront in the revolution of healthcare, driving innovation, improving patient outcomes, and paving the way for any type of technological advancement in order to be able to provide a patient-centric care in the future. So with all this said, I know medicine and technology has come a long ways within the past 100 years and more. So I'm pretty much, I'm a little excited to see what other type of medical advancements I will be able to see within my lifetime. And I'm excited also to use some of this information, some of this knowledge and discoveries and put this into practice as a future nurse practitioner, family nurse practitioner. So other than that, thank you so much for your time and cooperation. And thank you so much for listening to my presentations on nursing informatics. So once again, my name is Eduardo Garcia, and thank you. You have yourself a good day. Bye-bye.